Hi everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, we're going to talk about flying after knee replacement surgery. So probably the biggest question is, when can I fly after knee replacement surgery? And really this is a discussion to have with your surgeon, and it's going to probably depend on the specifics of the situation. Exactly how far out are you? When are you planning to fly? How far is the flight? Is it a few hours? Is it across country or across the world? So things to really keep in mind and really having that discussion. Most doctors, most surgeons are going to say about 3 months or 12 weeks. Some are going to be more conservative. It also depends on your personal circumstances as well. If you're someone who maybe has a history of blood clots or issues or complications after surgery, they might be a little bit more conservative and say wait for 4 months or 6 months out before flying. Some surgeons may be a little bit more lenient. If you're someone who's relatively healthy, haven't had any previous complications, don't have many comorbidities, maybe you're just taking a short flight, they may give you a little bit more leniency, maybe say 8 weeks, 2 months. It's really up to having that discussion. But why do we even care about flying after knee replacement surgery? Well, what it is there's an increased risk of developing a blood clot in your leg, also known as a deep vein thrombosis or a DVT. And the issue with this is that blood clot can potentially break off from where it is and travel up to your lungs, and you can develop a blood clot in the arteries of your lungs, also known as a pulmonary embolism. And a pulmonary embolism is life-threatening and a medical emergency, so something we really want to avoid. So what can you do if you know you're going to fly after knee replacement surgery to reduce this risk? There's a couple of different strategies. So one is possibly wearing compression garments or compression stockings during your flight. We want to do our best to decrease that fluid and decrease that pooling of fluid and swelling in the lower legs. So wearing compression stockings, possibly talking to your surgeon or doctor about any anticoagulation medicines that you can possibly be taking if you aren't already. Aspirin, for example. You can talk about just moving your muscles and moving your body. So the best way to get blood and fluid out of the legs and back into your system is through muscle contraction. That's the pump. The muscle contractions are the pump that moves that fluid from your veins up toward your heart and the rest of your body. So doing ankle pumps, doing straightening your leg and bending your knee throughout the flight, getting up and walking, getting up and going to the bathroom can really help to reduce any risks of developing a blood clot. And then the other thing to talk about is just general hydration. So drinking plenty of fluids throughout your flight to help kind of move the fluid throughout your body. Getting up to go to the bathroom is also a benefit. If you have to get up to go to the bathroom, that means you're walking and moving throughout the flight. And doing your best to limit caffeine, limit alcohol during the flight as well is important. So when it comes to flying after knee replacement surgery, it really comes to having that discussion with your surgeon about the specifics of your situation and doing what you can to take appropriate strategies to manage your risk while you're flying as well. I hope you found this useful and insightful. Please be sure to hit that like button, hit that subscribe button so you can catch all videos related to knee replacement surgery, exercises, frequently asked questions, and everything else. And please leave your questions and comments below. I'll be happy to get back to you. Thank you very much for watching.